Welcome back to the discussion, Enhance Your Coverage with Compass Rose Medicare Advantage, sponsored by Compass Rose Benefits Group on Federal News Network. My guest today is Sherry Hebert, the Vice President and Chief Operating Officer of Compass Rose Benefits Group. Sherry, it was fascinating hearing you say that because that was exactly the points the expert from Consumer Checkbook was making specifically about Compass Rose. You know, he said it's with the people, the NSA, the CIA, the intelligence community, defense community, and diplomatic community. But he made the point about this is an outfit that gets the troops out of the sun. And when you mentioned that wheelchair incident or episode, that was one of the things he cited, including the pets for something that.
Pets. Yeah.
But I mean, he said it really gets down to the basics, and it's something he likes about the plan. Another question, what do retirees need to know about the FEHBP and Medicare Advantage?
Yeah, so as a member of the as a federal retiree and a member of the FEHB program, thing to know about Medicare Advantage is that you always stay a member of the FEHB. People worked a long time, and that's a great benefit that our federal retirees have. And joining a federal employee Medicare Advantage plan, you maintain your federal status, your FEHB status. You maintain the plan that you're a part of. So if you're a Compass Rose member and you were to opt into our Medicare Advantage, you're still a Compass Rose member. And so the other thing is, if you were to jump into Medicare Advantage and for some reason it wasn't for you, it wasn't what it cracked up to be, and you wanted to come back, you can come back anytime. You don't have to wait till next open season. If you get in January and by April you're like, you know, this isn't for me, I want to go back, you absolutely can come back, and we would help you transition back to Compass Rose. That's an important thing, and you don't have to wait for open season. I actually had a member call and ask me about that just last week. So I think that's an important point to make. When you join the Compass Rose Medicare Advantage, you don't pay any more for Medicare Advantage. It's, you know, you pay your premium, your healthcare premium, and of course you have to maintain your enrollment in Medicare A and B. But there's no additional cost for this added set of benefits. In fact, like I talked about earlier, we feel good that we're able to help pay for those Part B premiums, so you actually can save a little money in that as well. But I think that's the important piece, because members are going to get across the board. They're going to get all these commercial individual plans. That's what's being advertised on TV. The way you're joining is just like FEHB is a group health plan, if you will. You're joining a group Medicare Advantage plan. So you get the benefits of the group, but you can come back. And I think that's an important piece. You don't lose your FEHB status. You can come back even if it's not during open season. And by the way, you can actually join the Medicare Advantage option outside of open season if you're a member of the plan that's the Medicare Advantage plan you want to be in. So if one of our Compass Rose members didn't get around to it, if you will, during open season, and they're like, darn it, you know, in January, I really wanted to sign up for that, they can sign up in January or February or March. You can sign up for it anytime, and you can disenroll anytime. I think that's probably one of the biggest things I want people to know.
Well, you made an important point there. You don't want to ever quit the Federal Employee Health Benefits Program. You suspend your membership, but you remain with your plan.
Well, you don't suspend your FEHB. You continue to pay your FEHB healthcare premiums, and you stay in the FEHB program. You're just adding this enhancement to it. You're enhancing your benefits through this Medicare Advantage. So it's not like your traditional, what you're seeing on TV, individual Medicare Advantage plan. It's through the FEHB program.
Well, you know, the point the experts make too is that many people in the FEHBP, particularly retirees, all of the plans are good, but some are just too expensive. And they say many people have been in the same plan for 5, 6, 10 years, and it may have been a great plan, may still be a great plan, but it may be too expensive for them. And retirees in particular need to shop around.
Yeah, and that's why I think it's really important that for us, because we hear that feedback as well, and we work really hard to keep our premiums. So like I said, our premiums this year did not change, which is kind of a little unheard of in healthcare in general, that your premiums didn't go up. is to be able to help people on the financial side. So with this $1,200 subsidy a year, with this $40 per quarter over the counter benefit, with the added dental and vision benefit that's within the plan that maybe people could drop, maybe if depending on what their dental and vision needs are, could drop what they already have, which could save on money as well. Yeah, we and are very robust. So on our RX side, on our prescription drug side, we have $1 for your covered generic drugs for 30 days, $1 to pay for your generic drugs. So we worked really hard because we know that the prescription drug side of the house as we get older can become very costly. And so we want to make sure that we're taking care of as much of that as we possibly can. So our tier structure within our Medicare Advantage is very rich, and we hope people take a look at that. And we're happy to work with people. If they call us and they tell us what prescriptions they're on, that we can look up what those drugs will be, so there'd be no surprise come the first of the year when this rolls over, what they would be paying for their prescriptions. Because that's an important piece. And I would say that for anybody, you got to look at the whole picture before you make a decision. Really set out your priorities, like what's most important to you. Is it the cost? Is it the network? Is it the fact that you like to travel overseas? You want to make sure you have coverage. All of those things are important, but they're important at different levels at different times of our lives. And so really kind of taking a survey of yourself and your family situation on what's important to you for this next year.
The good news, bad news for federal workers and retirees is they have so many choices, and it's very confusing. And the pros all say zero in on a couple of them and take a look at those and look at all of the factors. And based on what you've said, Compass Rose should be one of them. Sherry, as we were talking about the fact that there is an embarrassment of riches, there are so many plans in the FEHB program, including for retirees. And it's bewildering to look at them. And the experts say, pick a couple, including the one you're currently in, and compare the benefits and whatnot. And you make the point that people should not quit any health plan. If they're going to go to a Medicare Advantage, you continue in that plan, but you suspend the coverage.
So for a federal retiree, you do have the option to suspend your coverage. But if you did that, you would not be eligible for the federal Medicare Advantage program. You would then be in one of the individual.
Do not suspend.
And in that, you don't actually purchase Medicare Advantage. You basically just enroll in getting this enhanced level of benefit. So you would continue paying your regular premium. You would continue having to pay for your Medicare Part A or Part B, and then you would enroll in the version of Medicare Advantage for that plan. So Compass Rose members would continue to pay their premium. They would continue to pay their Part B. They would enroll in the Medicare Advantage. They get all these added benefits, no extra cost for that. That becomes part of your premium. It's just part of what you're already paying, but you're getting a whole lot more for your buck. And we then turn around and give you $1,200 back over $100 a month over the year to help offset those Medicare Part B premium. So you stay in the federal plan. You keep that federal benefit.
Right. Do not suspend. Stick with it. And then, of course, the Medicare, the wraparound feature of this, if that's a correct term,
sure,
gives people so much more coverage in really every area.
Yes, it truly is an enhancement. And it's an enhancement at no extra cost to the member, which is the beauty of it all, right?
Okay. If you were shopping first time for a health plan, and particularly if you were in the intelligence community or the diplomatic corps or
sure,
the military, what would you focus on? What would you look for, and what would you avoid?
Yeah, so I think everybody, when you're looking for health, you always look at cost, right? We all look at cost first, right? So I would look at the cost, the full picture of cost, to include the subsidies, to include the benefits that bring you money back. And then I would look, especially if I'm on a lot of prescriptions, I would look at the pharmacy benefit, because the Medicare Advantage, you pay basically zero for any of your medical care, but you do have to pay for some of the pharmacy benefits. So after cost, I would look at the pharmacy. especially if I'm on any prescriptions. And I would make sure that I knew what my costs were going to be based on the prescriptions I'm taking today. And then what would I have to pay if I ended up on a really expensive specialty drug? What would that cost me? So in our plan, in our Medicare Advantage plan, if you end up on one of these high cost medications, it's on our tier 4, which is our specialty, you max out at $100 a month. Now, these are very expensive drugs. And so we built it in that that's all you would pay for that high cost drug, which is very rich in the prescription drug world. It's a very rich plan. So I guess, Mike, that's what I look at. And not unlike if I was a 40-year-old looking at a healthcare product, I would look at my out-of-pocket costs, and then I would look at those things that are most important to me. And where people can get in trouble is if they are on a lot of medications, and then all the benefits. Does it have the benefits that we have? Like, I like to travel overseas for my vacation. If I broke an ankle or twisted something, can I get care while I'm overseas, or am I paying for that out of pocket? Those are things that would also be important. So it goes back to those priorities for you and for your family. But that's what I would do. That's how I would approach it. And then always call or check the resources you have available to you online. We have a website people can go to. It's uhcretiree.com/compassrose. And there's a phone number there where you can call and talk to somebody about your specific situation and get the answers you need to make that really well-educated decision. I did want to make one point though, Mike. When I talked about how you could come in and out of Medicare or join anytime, you have to be in the FEHB plan that you would be enrolling in Medicare. Meaning, if you're not a Compass Rose member today, you would have to join Compass Rose through OPM during open season. And then once a Compass Rose member, you could enroll in the Medicare Advantage plan anytime throughout the year. I just wanted to clarify that point.
And the open season this year, correct me if I'm wrong, is November 8th to December 13th?
Yep, I think you're right.
Okay, and that's a good long period, and people should not do what we all do and wait till the last minute to do their shopping, because it's not rocket science, but sometimes it's close.
It's very complex. We've actually put some tools on there for the financial worksheet to help people work through the financials. That'll be on the website as well. And I know our members are going to be getting a lot of information through the mail to think about and look through. And we welcome people that aren't current Compass Rose members to give us a call and give us a chance to serve them.
I think the fact that some of your members have actually talked to the president says an awful lot about the company. So thank you, Sheila.
You're welcome.
I'd like to thank today's guest, Sherry Hebert, the Vice President and Chief Operating Officer of the Compass Rose Benefits Group. I'm your moderator, Mike Causey, and you're listening to Federal News Network. For more on the discussion, visit federalnewsnetwork.com and search Compass Rose.